comfort, rest, and sleep. The brain is a complex organ, and it includes four various areas: cerebrum, cerebellum, diencephalon, and the brainstem. The brain requires a certain amount of rest and sleep for the individual to function appropriately. Sleep is a circadian rhythm that is an internal process, and the circadian rhythm controls the sleep-wake cycle. The circadian rhythm reoccurs around approximately every 24 hours, and these rhythms will synchronize with situations in the environment, such as light and temperature. Our bodies enjoy a sleep-wake homeostasis. This assists the body to remember to go to sleep after a given time. The level of sleep is controlled, and the level of sleep will deepen according to the amount of sleep deprivation that the individual has experienced. Through most stages of sleep, the thalamus function is to allow the individual to block out external distractions. During REM sleep, the thalamus transmits images, sounds, and sensations that will influence the content of one's dreams. The stages of sleep are characterized as rapid eye movement, or REM, or non-rapid eye movement, or NREM. Each pattern cycles approximately 4 to 6 times each night. REM sleep is a rapid movement of the eyes that is accompanied by a decrease in muscle tone, and it is associated with the dream stage. Stage 1 of the wake cycle is non-REM. This is the first stage of sleep. During this time, the individual has alpha and beta electrical brain waves. The breathing is normal, and the skeletal muscle tone is present. Stage 1 can last 1 to 5 minutes and is approximately 5% of the sleep cycle. Individuals can easily be awakened at this time, but if they are not disturbed, the individual will progress quickly to the next stage. Stage 2, this is a more challenging stage for the individual to be awakened. The heart rate and the body temperature decreases. The first sleep cycle of stage 2 lasts for approximately 25 minutes, and it becomes progressively longer with each successive sleep cycle. This consumes 50% of the total sleep cycle. Stage 3, this stage is characterized by delta brainwaves. These have a low wave frequency and a high amplitude signal. If the individual is awoken in stage 3, they may have a mental cloudiness that will persist for 30 to 60 minutes. During stage 3, the immune system strengthens, and the muscles, tissues, and bones repair and regenerate. The pulse and the respiration rate are at their very lowest in stage 3. This is a very deep sleep, and it lasts up to 40 minutes. In stage 4 of the sleep cycle, the skeletal muscles remain atonic, meaning that there is a loss of muscle tone, and the muscles do not move. This protects the individual from acting out when they're dreaming and harming themselves. Breathing during this time is irregular and and erratic, the heart rate may be elevated. This sleep cycle occurs 90 minutes after falling asleep. While sleeping, an individual's body begins to rebuild, strengthen, retain memory, and improve mood and concentration. Sleep improves an individual's reaction time, hand-eye coordination, strength, and power. Total sleep deprivation is caused by losing a night of sleep or by staying awake. Sleep deprivation affects higher order cognitive processes, impairs judgment, decreases response time, and it can trigger seizure disorders, migraines, and tension headaches. Even losing 1 hour of sleep over multiple nights can have harmful cognitive effects. These effects can lead to worsening causative effects if the sleep deprivation increases. Insomnia is an ongoing inability to sleep, despite having ample opportunity to sleep. Insomnia can present as the difficulty falling asleep or remaining asleep, waking up early, or feeling tired when waking. There are various chronic illnesses that are associated with insomnia: heart disease, hypertension, endocrine dysfunction, and arthritis. Central sleep apnea is a reduction in the brain's transmission of signals to the respiratory muscles. This causes a cessation of breathing. An example would be an opioid overdose and heart failure. Obstructive sleep apnea are recurrent episodes of the upper airway collapse and obstruction while sleeping. This is combined with waking from sleep. The common symptom for obstructive sleep apnea is snoring. The treatment is a continuous positive airway pressure device. This is the most recommended treatment and worn on the nose or mouth and nose while asleep, and air pressure is delivered to keep the airway open. Narcolepsy is a chronic sleep disorder that is characterized by sudden sleepiness and sudden periods of sleep. The individual will have difficulty staying awake, experience nocturnal hallucinations, paralysis while asleep, and vivid dreams. Cataplexy is a brief loss of voluntary muscle tone that is triggered by emotional stimulus like laughter. This is common with narcolepsy. Hypersomnia is excessive daytime fatigue without improvement after obtaining more sleep. Hypersomnia is not associated with poor night's sleep or a disturbed circadian rhythm. The signs and symptoms for hypersomnia include poor memory, depression, a shorter attention span, and irritability. Restless leg syndrome, or Willis-Elkbaum disease, is an uncontrollable urge to move the legs. Individuals report this is often accompanied by an uncomfortable sensation. Medications used for sleep include GABA agonists, non-benzodiazepine hypnotics, melatonin, antidepressants, and histamines. GABA agonists or benzodiazepines, such as alprazolam, clonazepam, or lorazepam, may cause drowsiness, relax muscles, lessen anxiety. They are used cautiously in an older adult that has a decreased liver and kidney function. Individuals can develop a physical dependence on these medications, and these are not recommended for long-term use. Non-benzodiazepine hypnotics like zolpidem, Xenophon, these are the most prescribed sleep medication. These do have an adverse effect, which is gastric discomfort, hallucinations, or memory loss. And they have abuse potential because higher doses will induce stimulation and euphoria. Controlled release melatonin is recommended for the older adult. It is very cost effective, non-habit forming, and has very few adverse effects. There are over-the-counter medications that can be used. Doxylamine, succinate, and diphenhydramine. Also, there are non-pharmacologic interventions that can be used to help promote sleep. Acupuncture, thermotherapy, or massage. Massage actually assists in relaxation of the muscles. It improves the circulation and decreases fatigue for an individual.